All right, so I got a couple things for us to do today besides this. All right. What was I doing? I don't remember what I was doing. All right. We were talking about preload. So the person is probably bleeding out somewhere, right?
Right.
That's causing the blood or the heart not to be able to pump adequately. So if I have a puncture wound to my chest, puncture wound, penetrating wound, whatever it is, and it goes into my lung. What structure? Actually, let me back up a little bit. So, to refresh our memories, we have the lung itself. What covers that lung?
The ribs.
What was that?
The ribs.
No, not the ribs.
The pleural lining.
All right, the pleural lining. All right. So all right, we're going to talk about this. So for whatever reason, there's a small hole, let's say an ice pick. It had punctured my lung, and now my lung is starting to bleed. And blood is collecting within that pleural sac. What kind of injury do I have?
Pneumothorax.
All right, a hemothorax. Now, if air is leaking out and blood is accumulating, now what do I have?
Hemopneumothorax.
There you go, a hemopneumothorax. Now this is taking you back to shock, then some. So I have an opening in my chest and air is building up in there. And so the pressure is building up within my chest cavity. What emergency can build up? Or what emergency can be created?
Did you say you had air leaking out?
What was that?
I didn't hear what you said. I'm sorry. I had stepped away. Did you say you had air leaking out?
No, well, no. Air's leaking into,
Oh, okay.
or not leaking it into. Air's coming into the chest, and it's collapsed the lung, and the pressure's building up. So what emergency is the patient developing?
An open chest wound?
Well, we already had that because of the opening to the outside. But more specifically, what traumatic emergency do we have as a result of that pressure building up?
A sucking chest wound?
Same thing as an open chest wound.
Oh.
That's just a type of injury.
Is it a tension pneumothorax?
There you go. And so what is a tension pneumothorax?
When air is getting into the chest cavity, but there's no opening?
Not necessarily. There's air going in. Some of them can leak out too, but there's more to it than just that. There's a reason why a tension pneumothorax actually, or the treatment, actually takes precedence over CPR.
Is it because it compresses like the heart and the veins inside the thoracic cavity?
Okay. So as the pressure builds up, that's starting to put pressure on the heart. So is the heart going to be effective when it pumps?
Yes.
No.
No.
No, it's not. Now, what about the signs and symptoms? What will you see?
Respiratory distress.
Okay.
Jugular vein distension.
Okay. So why is there jugular vein distension, JVD?
So if on the right side, if your lung is beginning to swell because of the pressure buildup, it's gonna.
Well, the lung's not swelling.
Well, not
The lung's
swelling.
Remember, the lungs collapsed.
They're putting pressure on the heart. So the section where the inferior vena cava leads,
No, it's not
or
the.
even
Oh.
on the other side with the aorta where it branches out into the carotid and where the jugular veins are, it could be suppressed.
Let's go back to the lecture on CHF. What causes JVD and CHF?
The heart can't pump?
Okay. And so what happens because the heart can't pump adequately?
The blood like backs up?
The blood starts to back up, right, on the right side. And so where's the blood coming into the heart? From above the heart.
From the inferior and superior vena cava.
Well, remember, above the heart.
Superior.
The superior vena cava, which in turn, where's that blood coming from? That goes into the superior vena cava.
Maybe the arms and the head.
What blood vessel?
What do you mean?
Okay.
The jugular vein feeds into the superior vena cava.
Yes.
Yes, it does. So that's JVD. All right, what else?
Chest pain.
No, not well. Yeah, from the trauma, but that's not one of our signs and symptoms that we're looking for.
Tachycardia.
Okay, but you can have tachycardia with a lot of different injuries.
What about rapid breathing?
Okay, same thing. You could have that from a lot of different injuries.
Unequal movement of the chest.
Not necessarily, no.
What about deviation of the trachea?
Okay, why?
Because when you palpate, it moves to the,
You don't have to palpate to get tracheal deviation.
or doesn't it move to the side that it's not injured
Okay, why?
because there's no pressure there?
Okay, but I mean, why is there tracheal deviation?
I don't know that.
Isn't it because there's like a buildup in the pressure in the chest?
All right, because of the increased pressure buildup, it's actually shifting the organs over.
Okay.
And so it's creating tracheal deviation. What else are you going to see?
Absent breath sounds?
Okay, absent breath sounds over what side?
On the opposite side where there's no pressure,
Nope.
or on the side that does have pressure?
You can have absent breath sounds over the affected side. What else?
Fluid in the lungs.
Not necessarily. I mean, you may, but from the blood, if there's any blood, but that's not with tension pneumothorax.
So I'm thinking if you have heart failure, then eventually you can have pulmonary edema.
Correct, but we're not talking about pulmonary edema. We're talking about tension pneumothorax. I just wanted the reason I mentioned CHF was to go over the pathophysiology of the JVD. So why the actually, what else?
Shock.
Sign symptoms of shock. Okay. So what about this? So attention pneumothorax, again, we know that it starts out as a pneumothorax, but as the pressure increases, it's going to put pressure on the heart. The heart will become ineffective. So we will have absent breath sounds. We will have JVD, tracheal deviation. Obviously, they're going to have shortness of breath. They're going to have tachycardia. Now, there's another thing that you can do to check to see if they have a tension pneumothorax. And really even a pneumothorax. And that's percuss the chest. So put it this way. I have my bottle of water here. And if I tap it, you hear the difference down below where there's liquid? Okay. Whereas where there's air, how is it going to sound where there's air?
Like a drum.
Okay. A little echoey.
Yeah.
As opposed to if there's fluid there, then what happens to the noise?
It's like a thud.
It's a thud. And the way you percuss is you've seen them on TV where they put their hand on there and they tap on it. So it's that tapping. So with a pneumothorax or a tension pneumothorax, it's going to be hyper-resonant. Whereas with a hemothorax, it's going to be hypo-resonant. Hyper-resonant where there's air, hypo when there's fluid. So you got to get the paramedics out there to take care of your tension pneumothorax patient.
Is that when they put the needle?
Yep. Almost did it to this dude years ago out in heading towards Van Horn, but the helicopter got there before I could do it.
Where do you put the needle? Is it like a specific spot or just?
It doesn't matter, but yeah, there is a specific spot. All right. I'm just trying to think how I set it up. All right, so Brisa is mad at me. Lisa's mad at me for whatever reason. And so she takes a baseball bat and she hits me in the ribs. And she breaks some ribs. And so Kayla, as my savior, comes in. She's the EMT. And she visualizes where I got hit. One, there's bruising, obviously. But two, she notices some abnormal movement of my chest wall. So A, what's the injury? And B, what is that abnormal movement of my chest wall called? And C, why?
A flail segment.
Okay.
And the movement.
So what's a flail segment?
It's when like 2 or more ribs fracture.
Okay, it's more. There's more to the definition than just 2 or more ribs.
Well, it like it affects the rise and fall of the chest.
Are they bilateral fractures?
No, it can be, but not the definition of a flail segment.
It's when it produces like the unequal rise and fall of the chest, because like the free movement.
Okay, but what's the definition of a flail segment?
Did you know when like the segment of the ribs gets detached?
Okay, but what constitutes that segment?
3 or more ribs fracture?
Not 3 or more. Although I've seen books that say it's 3 or more ribs, but that's not true.
Is it when it separates the from the cartilage?
Nope. Definition of a flail segment is 2 or more ribs broken in 2 or more places.
It's few.
Flail segment, 2 or more ribs broken in 2 or more places.
Two or more.
2 or more ribs broken in 2 or more places. Now, what is that abnormal? How did I call it earlier? The abnormal movement?
Yeah,
What do you call it?
the paradoxal movement.
What was that?
The paradoxal movement.
Paradoxical.
Paradox.
So what is paradoxical movement?
Is that when your chest moves in like opposite directions? Like one side is coming up and the other side is going down, or?
Like the affected area.
Yeah, just think about the paradox. When we take a breath, what happens to the chest wall?
It goes in.
No.
I mean, it goes out. Sorry. I mixed it.
What happens? Remember the question was, what normally happens when you take a breath?
Chest rises.
Chest expands
Yeah.
or chest rises. However, the paradox, because of that paradoxical movement, the flow segment, what do you think happens to that flow segment when we breathe in?
It falls.
Yeah, it falls. It's collapsed. And so when we exhale, what happens to the chest wall?
Rises.
No, when we exhale.
Compresses?
Okay. No, I wouldn't say compresses, but
It falls down.
yeah, remember it gets smaller. And so what do you think that flow segment does?
Rises.
Comes out. So, as a result of Brisa kicking my ass, how would you take care of me? Besides stealing my computer to change your grades.
Right oxygen.
How?
Non-breather?
Nope.
CPAP?
Is it high flow?
Nope. Well, high flow, but how?
With the BVM?
There you go. Working to back the patient. That is the treatment for the flow segment is BVM. Now, can I be bleeding as a result of a pulmonary contusion?
Yes.
Yes, because that is the definition of a contusion, where bleeding occurs. Now, without pulmonary contusion, what can I have? Shortness of breath, cyanosis, because that part of the lung is ineffective. So the alveoli are not going to be getting any oxygen to send to the bloodstream. So somebody earlier mentioned a sucking chest wound. So tell me more about a sucking chest wound.
It's when air is entering the lungs or the chest cavity.
Wait, run that by me again.
Is when air is being sucked into the chest cavity.
Okay, from what?
Could be a gunshot wound.
From what?
A gunshot wound.
Okay, mechanism.
Like an open chest wound?
Okay. So basically there's an opening and it's sucking air in. And we talked about the possible consequences, attention pneumothorax. So how do we take care of that sucking chest wound? So Joanna stabbed me in the ribs, the chest, because I told her she had to buy her own coffee.
With
What
your glove hand?
Wrist pain?
Okay, two were talking at the same time. What was that?
With your glove hand? You first intensify and then put dressing and then just put tape around like just 3 sides?
Okay, so we can cover it up and Now, what kind of dressing were you putting on there?
The three sides, so the air could come in and out from one of the sides.
Okay, but what do we call that kind of dressing?
Occlusive?
What was that?
Occlusive?
There you go. An occlusive dressing. And we tape it down on 3 sides. Why 3 sides?
So one side the air could go in and out.
Now, we don't want air coming in,
And well, like out.
because if we want air in, just why put the thing on there?
So the air could come out.
Yeah, it's so air can come out. When the patient breathes in, that occlusive dressing will drop down over the opening and not let any air in. And as we exhale, it opens up that valve and it allows air to go out. Is it time for dinner yet?
You got 3 more hours, Lou.
You want to bet? Maybe you guys have 3 more hours. I don't. Hey. So, I guess we're not saying anything, but this is a SANS plant for a sucking chest wound. This is some of the new stuff that they have out there. They're just applying it on the chest and done. Pretty easy to remove.
Wait, how does it let air out? Let air out.
On this one, it doesn't. Or some of them have a way. Let's see. There's a couple others. The Halo is one. That's a good one. Our military uses the Halo.
The Sleep Number 360 Smart Bed is on sale now.
Can it help keep us asleep?
Absolutely. It senses your movement.
Hey, welcome to another video from Skinny Medic. In this video, I wanted to review the Halo chest seals versus the Hyphen chest seal. So, hope this video helps. So the reason why we put chest seals on trauma patients is because we have penetrating trauma. I mean, there's just a hole in the chest. Typically the chest, thoracic cavity, even the abdomen, up into the neck. We want air to go in and out of our mouth, which is important because that's going to go into the lungs. So air is going to take the path of least resistance, which is why we have a hole in our chest. Air will typically come out of our chest wound, even on the back side as well. So that's where you get the term sucking chest wound. So that's why we put these seals on there to help seal that area up, to allow air to come up and out of the trachea into the lungs, which helps us breathe. So one of the questions you get asked quite frequently is about putting combat gauze, wound packing in this area here. And you do have some very vascular things, obviously like the heart, you've got the liver, spleen, you've got some major arteries and veins that run through your thoracic cavity here, but you can't really wound pack those because you've got to be able to put pressure against them to get them to stop bleeding. So it's very difficult to wound pack the thoracic area. I'm not gonna say you can't do it. It's just it's hard to do. You're gonna run a lot of combat galls, Celox trying to pack this area. But the main concern is air, which is why we do chest seals on front and back, things like that for penetrating trauma. I've already done 2 separate videos on these chest seals. So I did a video on the hyphen chest seal. I also did a video on the halo chest seal. I'll put links to those in the video here, and I'll also put them down in the description. So if you're just looking for individual review, you can go click on those videos. So now obviously both of these are non-vented chest seals, means they do not have a vent or a valve to release pressure that builds up. So what happens sometimes is you get pressure building up, whether it be blood or air, in the thoracic cavity, and it starts causing a tension in your pneumothorax. So these are going to have to be vented, means once your patient starts having more trouble breathing, things like that, you may have to peel these back here to release that pressure, being air or blood. So these are non-vented chest seals. They're both non-vented. This is an example of a vented chest seal. You can see this one has vents that come through here, that when the air or blood starts building up, it's going to come out and travel through these vents. So, but this halo and this hyphen are both non-vented. I unfortunately didn't save the original packaging, but they're about the same size. You do get 2 chest seals with a hyphen here. I've lost the other one. I didn't save it. So what you would see is you get 2 here. So you still get 2 chest seals, whether you're getting the halo or the hyphen. It's just I've lost one and I lost.
Anyway, as you guys can see, unless you're Ina and she's looking down, not looking at the screen.
Sorry.
So 2 types, as he mentioned, they don't vent, but they do have some that vent. But it's just putting them on there, slapping them on there, seal them up, and it will take care of it. What can you use as besides those? What can you use for an occlusive dressing?
Ziploc bag.
Ziploc bag.
IV bag.
What part?
She didn't tell us. She
Okay.
just said the bag.
Okay. What else?
Paper bag.
No, not a paper bag.
No.
Plastic bag.
Okay. How about the little package where the cannulas and masks come in? Remember I talked about, or did I talk about with you guys, Vaseline gauze?
I don't think so.
No. What I was taught years ago, and they still kind of they have them, is Vaseline gauze. But nowadays, instead of using the actual Vaseline gauze, they use the Vaseline gauze wrapper and use that instead. So, I mean, it still works. Still works. So, all right. Anywhoots. Ooh, traumatic asphyxia. Oh, do I have? All right, let me give you a scenario to you guys. This actually happened. I saw the guy get brought into the ER. I remember hearing the call get toned out. So the guy was working under his car. Ina,
Yes, sir.
did you want me to get a little mustard for your hair?
No.
Is that hungry?
No, I'm tired.
I am too. Come on, hang in there. So anyway, he was working on his car. He lifted up his car. Well, one or both of the jacks gave way, and he's working underneath his car. Well, guess what happened? Car on the chest.
Ooh.
So, what is happening with the weight of that car on his chest?
Pressing against it.
What was that?
It's pressing against it.
Okay, it's pressing against his chest, doing what?
Not letting the chest rise and fall. Well, rise actually.
Okay,
So
what
you
else?
can't breathe in. Yeah.
What else?
Crushing it?
Well, it's crushing it.
It also adds pressure to the heart, which is causing the tension pulse, I guess, again.
No,
In a
remember,
way.
tension pneumothorax is there has to be something that's causing air to rush into the chest. It's not a tension pneumothorax.
Well, I'm not saying it is like, but I'm saying it's crushing it to heart. I mean, causing the heart not to pump functionally.
Okay. So it's building up pressure within the vasculature, right? And so as a result of that, what color is the person going to be? The area that was above the crushing injury.
Blue?
No, it's not gonna be blue.
Purple?
Would it be stenosis?
Purple. It's gonna be
Okay.
purplish red. Well, it says bluish, but no, it's gonna be more purplish red color. They can have burst capillaries as well. And so they brought this guy into the emergency room, and CPR was in progress. The gentleman didn't make it. So it's all that pressure on the chest, backing up pressure, causing that discoloration. And it's typical of when a heavy object falls on an individual's chest. Mm. All right. So as far as treatment, how do you think we would treat this? If they're in cardiac arrest, obviously we do CPR. What else?
EVM?
All right, BVM.
Should we also treat it as shock?
For shock. And that's about it. Not too much to do. It's more of the hospital will take care of this or try to take care of this whenever possible. All right. We've kind of talked about bruising of the heart before. But now, just like the lungs are surrounded by a sac, so is the heart, right? What do we call that sac?
Pericardium?
What was that?
The pericardium?
All right, the pericardial sac. No, the pericardium is the outermost heart muscle. The pericardium is the outermost layer of the heart. But the sac is called the pericardial sac. So you're close. All right. So if we have an injury to the heart, like Steve Irwin, but not as severe, and we have blood that's leaking out of the heart, now the pericardial sac is keeping that blood in there. So now what is your patient suffering from?
Pericardial tamponade.
Pericardial tamponade. All right, so what is occurring in pericardial tamponade? And I don't mean bleeding out, causing the blood to stay within the pericardial sac. I mean, what are you going to see and what's going to be happening?
Brucey?
What was that?
Decreased cardiac output.
Okay, decreased cardiac output. How so and why?
I would say because if the fluid is beginning to build up within the pericardial sac, then it's going to depress the heart. It's going to be placing a lot of pressure on the heart, so the heart can't really pump effectively against that pressure.
Exactly. As the blood is coming out, so here's the pericardial sac, here's the heart. So normally the heart glides against the pericardial sac, but we have blood starting to build up and it's pushing against the heart muscle. So how effective is that contraction going to be as a result?
Yeah.
Not very.
Not very. Thus, the decreased cardiac output. So now, what are your signs and symptoms of pericardial tamponade?
Low blood pressure.
Okay.
Signs of shock.
Okay.
Decreased heart rate.
Okay.
JVD.
All right. Anything else?
Distant heart sounds.
Why? Why the muffled heart sounds?
Because it's encased in that fluid sac.
Okay. So now let's take a couple of those signs and symptoms. JVD, muffled heart sounds, and hypotension. What do we call that collection?
Beck's triad.
Carlos is looking at me all weird. What's Beck's triad, Carlos?
Give me a sec.
So just like Cushing's triad is indicative of increased intracranial pressure, Beck's triad is indicative of pericardial tamponade.
Can you spell that for me? I'm trying to.
B-E-C-K?
B-
B-E-C-K. Beck, apostrophe S, triad, T-R-I-A-D. So Beck's triad. So anything we could do for Beck's for a pericardial tamponade?
Not really, just provide oxygen.
Yeah,
Rapid transport.
O2 vitals, rapid transport. Not too much, really.
There's no way to decompress the sac like you can with the lungs.
No, well, pericardial tamponade there is, but I can't even do it. So, as EMTs, a lot of it is call ALS or get them haul ass to the hospital. Um, all right. So, what are you looking for when you show up to a trauma call?
Mechanism of injury.
Okay. So you're looking at the mechanism. What else?
Number of patients.
Okay. Mm-mm-mm. Are they going to have signs and symptoms of respiratory distress?
Just like
Okay. And what are some of those signs and symptoms?
regular chest movement.
What was that?
Irregular chest movement.
I still couldn't make out what you're saying. I'm sorry.
Irregular chest movement.
Okay. That's on physical exam. Okay. What else?
Wheezing.
Wheezing? Not necessarily. I mean, toxic inhalation. Okay. But
Cyanosis.
you got to speak up. I can barely hear you.
Cyanosis.
Cyanosis. Anybody else? Signs, symptoms, of respiratory distress.
Tripoding? Or
Tripoding. What else?
Any open wounds to the chest?
Right now, I just want to know signs, symptoms of respiratory distress.
Tachycardia.
Hypoxia?
Carpal pedal spasms.
That's more of a hyperventilation. Anyway, so you guys gave me signs, symptoms of respiratory distress, and you gave me some of having to do with chest trauma. Get a history. Look at the mechanism. Look for those signs and symptoms. Look for any marks. Look for entry wounds. Look for exit wounds. Listen to lung sounds. Now, just like with the medical respiratory emergencies, do we want to withhold oxygen?
No.
No. Are these types of calls going to take precedence over other issues? In other words, do chest injuries take precedence over other issues?
What do you mean? I don't understand the question. Like, does it cause something else or what?
No. Does it take precedence? In other words, is it more important than other issues?
Not them burning or bleeding.
No, it actually takes precedence over bleeding.
Even so, like severe bleeding.
Even what?
Like severe bleeding.
Yeah, because isn't breathing come before circulation?
Yeah.
So yes. All right. Other thing. Oh, so I would expose the chest early on to look for any signs of trauma to the chest. Any bruising, any paradoxical movement, any puncture wounds, any bruising to the chest over the heart. So look for signs early on. How often do you think we're going to reassess them?
Every 5 minutes.
Okay. All right. Any questions?
No, sir.
No.
All right. Are you guys ready to hate me even more? That's right. What? We don't hate you, Lou. All right. I want to hear participation. I want to see little rings glowing. I want you guys to think about and discuss this. I'm just over here to answer questions. So let's see how you do. You'll encounter a wide variety of patients in your EMS experience. You'll even encounter patients who appear to have experienced the same condition or injury, but experience a very different outcome. This exercise will ask you to finish the story of a patient who has experienced a traumatic injury. So the call is Bill working on the
Are you gonna put cheese?
Bill was working on the roof of a two-story house when he lost his balance and fell to the ground. He is able to speak and tells you that although he hit hard, his fall may have been broken by some bushes. He complains of pain to his left shoulder and forearm. You observe deformity in the forearm. Although Bill talks to you, he seems like he may be a little confused. So the story, you fill in the rest of the story specifically. Do you believe Bill has other injuries? Why or why not? If so, what are they?
Yes, because of the confusion.
So I want you guys to talk about it. Think about it some more.
Yeah, also the fall, the story, so it's more than 10 feet, so it's pretty big, pretty tall. That would definitely give me some concern.
How high is that?
20 feet.
All right. Maricela. Oh, that's all right. You can type it out. So what do you think? Alexia, what do you think?
I think about all kinds of things.
She thinks Alexa, not Alexia. Alexa thinks about me all the time. Alexa, do you think about me all the time?
I don't know that.
Oh, you bitch. Go to sleep. That just deflated my ego. Thanks. And I was such a high too, but the morning class made my morning. You want to see what morning class got me?
Yeah.
Yeah. See it.
So ladies, pay attention.
Can you scoot back?
Oh, I'm going to read it to you. It's hard to read further back. It says, I'm a paramedic. To save time, let's just assume I'm right all the time.
Oh.
Yeah. What? Either you have a headache or you can't believe that.
I have a headache.
So why are you laughing? If you had a headache, you'd be in pain, you'd be miserable.
Oh, I have been since class started.
Oh, what does that tell me?
No, I went to work early. They switched my schedule, so I'm just kicking my butt.
All right. Yes, concussion as well. Because he seems a little confused. What else? Miss Alexia, what else?
Maybe internal bleeding.
All right, internal bleeding. What else?
Steve's fine.
Let's hear it, Ina.
What?
What other injury or injuries? Remember, trauma's about being psychics. So be a psychic. What else do you think might be wrong?
I don't know. Internal bleeding.
It's already been said.
Oh, I didn't hear it.
Concussion's already been said.
Broken bones.
Wait, what?
I don't know.
Did you say broken balls?
Bones.
It sounded like you said something else.
Oh, that can be a possibility too.
I don't know.
How do you break testicles?
You can't.
Do you pop them?
Ow. I didn't say that. Stop. But broken bones, I don't know. Yeah, broken bones.
What kind of broken bones?
Doesn't that thing say that?
deformity to the forearm, but what else?
What is it? I forgot this bone. The
Clavicle?
yeah, more than likely for sure.
I don't think more than likely, but okay.
What you're at?
Everything on his left side, like his head, his ribs, pelvis, elbow, leg.
Joanna, why are you screaming?
Okay, what else? Ay, madre mía.
So he could hear me.
You can suspect a spinal injury.
Okay.
Could he have like, I don't know, like twisted an ankle? That's why he like lost balance.
It's unlikely.
Or maybe
Well,
he's dehydrated because isn't he what? Hold on.
Could be.
He's in the roof. He's on the roof, so probably dehydrated.
Yeah, he could have gotten dehydrated and probably gotten like a muscle spasm, and then that's how he lost balance.
Oh, you guys are really stretching it now.
I just think he slipped. That's the more than likely thing.
But we're talking, okay. But we're talking about injuries.
Internal injuries?
What kind?
Like the abdomen? Because like the inside the stomach and everything, because anything above
Abdominal?
20.
What kind of abdominal injury?
You could have ruptured something.
Okay, such as?
A rib. He could have ruptured a rib and punctured a lung.
Okay, punctured a lung. What else? You guys do know that you take your final in less than a month.
Has anyone said cracked skull or like
fractured skull?
No, nobody mentioned a fractured skull.
Oh. Well, that
But he's conscious, no? So.
But he's confused. But a cracked skull doesn't necessarily mean that they're gonna be with it, or that they're gonna be confused, regardless. But that brings up another possible injury.
concussion.
Concussion.
All right, somebody already said concussion. I think that was Melissa that said concussion.
Spinal injuries?
What kind? I'm not letting you guys off the hook with generalized statements here. Come on, Dylan, let's hear from you. You've been quiet tonight.
Brain damage?
What about a cardiac contusion?
What was that, Dylan?
Everything I thought of been said.
No, I was rude up. I'm sorry. Can you say it again?
Everything I thought of has been said.
Nuh-uh.
Paralysis?
What?
Paralysis?
Okay.
When it comes to spinal injuries, it could be a compression injury, flexion injury, flexion rotation injury. I mean, there's gonna be so many injuries from a fall. I mean,
Well, I want you guys to come up with a story. What other injuries?
Shortness of breath, difficulty breathing. He doesn't feel
But that's not an injury. That's a effect.
Brain damage.
How so?
He hit his skull. He probably could have hit his skull.
Okay, so increased intracranial pressure from brain bleed?
Yes.
Subdural hematoma, epidural hematoma, arachnoid bleed. Somebody mentioned about or we talked about a shoulder injury. Could he dislocated it, fractured clavicle, scapula, the acromion process, fractured ribs, pulmonary contusion, punctured lung, pneumothorax, hemothorax, hemopneumothorax. You can get a tension pneumothorax, lacerated liver, maybe a splenic injury. I think yes, because that high fall. Oh, that was from earlier. Okay. What else? Fractured pelvis, fractured femur, dislocated hip, dislocated knee, facial fractures. See, that's what I mean by being psychic. Think about all that stuff. Is a 20-foot fall significant mechanism of injury?
Yes.
Yes. Because what was the magic number on the height?
20.
20 feet. How about for a child?
10.
Or?
Twice his size?
Not the size.
Height.
Twice her height. Because you can get to have a kid that's like this, right? Like two of me. You're supposed to say, no, Lou, you're not that big.
The heavier the guy, the heavier the fall.
I feel the love in this room today. Well, just for that, Carlos.
No.
Give me the vitals. Have fun, Carlos.
Pulse is high. So
Give me a pulse. Remember, you guys are finishing this. No help from Joanna. It's all on you.
Lou, stop. 120.
Okay.
Per minute, and then.
So while Carlos is figuring it out, writing it on a piece of paper so he can give it to us, Miss Claudia, can you do me a favor?
Yes.
Do you have a piece of paper in front of you?
Yes.
All right. So we know that Carlos here, or I'm sorry, it's Bill. I was going to name him Carlos, but Bill here fell down. We know he has an injured shoulder and a deformed forearm, left forearm. So what I want the rest of the class to kind of give you is, let's just say what other injuries he has. I don't mean that big list that we came up with. I mean, give us about give Claudia about 2, 3, 4, between 2 and 5 different injuries. No, actually make it 2 to 4 different injuries.
Like ones that we've already said?
Yeah, just come up with, just pick 2 to 4. Or actually, let's make 3 or 4 injuries.
Could it be just dislocation of the shoulder?
Well, we already, okay, do you guys want to use a dislocated shoulder?
Rib injury.
All right, let's back up. Do you guys want to use a dislocated shoulder?
Yes.
Yeah.
All right. So what kind of a rib injury?
Fracture.
Well, just a single rib, or do you want to give him a flail segment?
Single rib.
Single rib?
Hey,
I guess so.
Can Can I see the list again?
What's the vitals? Where's the rib fracture at? Left or right?
On the left.
All right, one or two more injuries.
Concussion.
How about a punctured lung?
Which lung?
If it was on the left lung.
Okay. So based on those injuries, Mr. Carlos, what are his vitals? What's the pulse rate?
It's high, 120.
Okay.
And then respirations are high too because he's trying to make the body's trying to make up. Did you guys mention internal bleeding?
Does it look, well, we don't know.
Pupils would be normal since there's no head injury, correct? Or did he hit in his head?
He has a concussion.
Oh, okay, so then pupils are dilated.
Really? Is it nighttime?
Unequal.
You what?
What if we say unequal? Can we? Because he has concussion.
Unequal?
Yes.
Okay.
I'm having trouble with the blood pressure though. I wouldn't. How can I determine that?
Well, think about it.
I know that I said the pulse is high, so blood pressure would be high, no? Since
What do
it's
you,
trying.
what do you guys think? Should his blood pressure be high?
No.
Anybody else want to help?
I think yes, because he's having trouble
Yeah.
breathing.
Yeah, and because of the pain.
But doesn't he have a punctured lung?
Yes.
I see low two.
Okay. So what do you think then, Carlos? What's his blood pressure?
High. What is? $135 over 80?
What?
No, isn't that kind of high?
Are you using a BP cuff or are you using it manual? Or are you getting it manually?
Manual.
And you got it 135? Who? Joanna, smack him for me.
Dude. Oh.
That's not smacking him.
I would appreciate help from my classmates right now.
Welcome to my world. The crickets are louder than your classmates.
Can I give it a try?
Sure.
Lou, do I write this
like
down too?
Yes, ma'am.
Okay.
So
a
pulse
blood pressure
120
of like
reps. You didn't give, what number did you give us, Carlos?
I said 130 over 80.
No, I'm asking you for aspirations.
22.
Really?
Well, that's what I said.
For a guy with a rib injury, he's breathing at 22 times a minute.
He should be
I'm
breathing
faster than
faster.
that looking at you. And when I think about you every night.
No, he should be breathing faster.
So go ahead, Vanessa. What's the
A blood pressure of like 174 over 102.
Okay.
Respirations of 26.
Okay.
And he's got a pulse of 123.
Even numbers.
124.
And Carlos, you said pupils were what?
Uneven.
Unequal?
Yes, unequal.
All right, what about skins?
Cold and clammy.
Correct.
You're not gonna say color, temperature, or moisture?
Pale, cool, and clammy.
Thank you, Miss Kayla. You're awesome.
And he's sitting at 92%.
He's what?
The pulse ox is 92%.
The pulse ox. 92%. Okay.
All right. So with what we have created, is he stable or unstable?
Unstable.
Unstable.
Hi, Anna. All right. And would you transport him to a trauma center?
Yes.
Yes.
What about ambulance or helicopter?
Ambulance.
Depends on the distance.
You're in Ruidoso.
Helicopter.
Helicopter.
Well, you don't trust the hospital up there?
Hell no.
Actually, one of my former students, he drowned up there. And he was in a coma for a long time. All right. Is there any more information you need, Miss Claudia?
I don't think so.
All right. So give us a synopsis. What happened to Bill? So Bill fell off a second-story roof, approximately 20 feet up. Landed on his left side. And what kind of injuries does he have?
Rib injury.
Left-sided rib injury.
A left single rib injury. He has a punctured left lung. He dislocated his left shoulder, and he has a concussion.
Okay, and what are his vital signs?
Okay, which ones do I tell you, Carlos or?
All of them. Well, you put them all together.
Okay, well, his blood pressure is 174 over. Oh, Vanessa, what did you say?
I don't remember what I said.
What's that
174.
for? 102?
102. Okay. His blood pressure is 174 over 102. His respirations are 26. His pulse are 124. He has unequal pupils. His pulse ox is 92%, and he has his skin is pale, cold, and clammy.
Okay. And were you route 2 on your ETA?
Okay, what was that?
Were you route 2?
We are en route to the hospital.
Which one?
To Ruidoso. The one in Ruidoso? I don't know.
Well,
To Del Sol.
they said they were going to fly him out.
Oh, okay. So we need a air. I'm sorry?
Which hospital is he getting flown out to?
To Providence.
They're level
Or
3.
the Horizon, or whatever. I don't know.
That's a level 3.
He would have to go to either Del Sol or UMC.
Okay, UMC.
And what do you think the flight time is?
About 45 minutes to an hour.
Yeah, about an hour or so. All right. Alrighty. I have 8:01. Be back at 8:16.